What do you expect commonly under stomach? What are all the common headings? Don't tell me about Cinchona. Tell me about the common headings. What all can come under stomach? Very good. Ulcers. See, I'll tell you, before we go further, I am not telling you the symptoms of Cinchona. I am just giving you a small clue. Whenever tomorrow you discuss stomach, you will have to have all these things in mind. So it can be simple inflammation. Okay, pathology class just now it got over. Inflammation. And then it can be ulcers. Good. Gastritis. You are talking about big things. Fine. Good. So inflammation, there can be ulceration, and in the worst scenario there can be cancer. Good, very good. Cancer of stomach. What else? Stomach will be very good. There can be indigestion. Yeah. Now you are talking about simpler things. Indigestion, acidity, beautiful, good. Indigestion, acidity. Okay, there can be less absorption, more absorption. Generally, absorption happens lower down, little down. Okay, we'll limit to stomach. We'll come to intestines a little later. Okay, very Indian about stomach. Distension, gas, distension. What else? Very good. Flatulence. Like for example, erectations. You have burps coming. Okay. Okay, your burps coming. Then what else? Achalasia, fine, no problem. Gas, nausea, vomiting, very good. Simpler things. Nausea, vomiting, better. See, these are all the common headings that we'll be having under stomach. So whenever in material class stomach is discussed, you will have to keep all these things in mind. Mind you, all these things will not be there in one remedy. There will not be carcinoma, or there will not be gastritis, there will not be achalasia cardia, whatever it is. Everything you will not expect in one remedy. But these are all the headings. If you remember these headings, things will become very easy for you. Okay? Fine. Now we'll get back to Cinchona. Now use your sphere of action, use your ailments from. What did you see when we discussed under sphere of action? Cinchona ಏನು ಮಾಡುತ್ತೆ stomach ಮೇಲೆ act ಮಾಡಿ? Why is flatulence coming up? Yeah, very good. It's a trios of flatulent remedy. But nobody knew before they proved Cinchona was trios of flatulent remedy. So when patient came out with flatulence, he was not aware that Cinchona is a trios of one of the trios of flatulent remedy. Okay. Now simple thing. Why flatulence? Why all these things? Simple thing is the digestion. The digestion is weak. You getting my point? The digestion is weak. There is indigestion, dyspepsia, difficult digestion, weak digestion, and this in turn will give rise to gas formation in Cinchona. So first point, weak digestion. So what happens when the digestion is weak? The food do? Now use your physiology. How many hours food stays in stomach? 3 to 4 hours. So what is happening here in Cinchona? Is the digestion happening correctly? So digestion is not happening properly. So what is happening? Now you have that gas formation, you have got that fullness, heaviness. These are all the results of weak digestion. Bloating, yes, bloating will come up. Food stays long. So what will happen to the food? Simple common sense. Very good, decay. I can't use the word decay here, but medically we can use the food gets fermented. You are getting my point? Are you all following this? Yes. So, materia medica, when you study, please understand and study. You know why there is indigestion, you know why the food is getting decayed, the food is getting fermented. Now when the food is fermented, when they have burp, what will be the kind of burp they will be having? You are getting my point? You are getting my point? So these are all linked. And materia medica is a subject which can be explained very easily, if you understand like this. Otherwise it will become very confusing. Clear? Okay. So the first, see, one word, weak digestion, gave you some 10 to 12 symptoms. So don't by heart. Understand. Okay. So what is that under the stomach we are trying to understand here is that digestion in there, that digestion is weak. So weak digestion gives rise to indigestion, food stays in stomach for long, it is fermented, fine, and then there is distension, gas formation, bad smelling burps, all those things. Okay. Stomach will also have another very important heading, and that will be desires and aversions. Under stomach, you have this heading. What is that? Desires and aversions. This we have already discussed under characteristic symptoms. Yen ista Cinchonage? Very good. Sweets. One more. Yeah. Highly seasoned food. Sweets and highly seasoned food. So that you can write under desires. And what Cinchona will not like? Yes, coffee is style, beer is style, fruits is style, butter is style, and one more very important thing, tea. Yeah, beer, alcohol. Yeah, alcohol. Okay, chalo. Shall not spare me. Alcohol. Okay, tea somebody said absolutely right, and somebody was talking about fruits. Cinchona has got ailments from fruits, ailments from tea, ailments from coffee. So these are few aversions Cinchona has. So desires bantu, aversions bantu. See, these are all the common headings. Do remember, whenever you are writing your materia medica, desires and aversions will be written under stomach. Okay, fine. And even one more very important topic that can be discussed here is thirst. Thirst also will come under stomach. And Cinchona, see, when I talk of thirst, what are all the probabilities here? Very good. There is increase, there is decrease. Cinchona will have increased thirst. Okay? Cinchona will have increased thirst. ತಣ್ಣಗಿರೋ ನೀರು ಜಾಸ್ತಿ ಕುಡಿಬೇಕು ಅನ್ಸುತ್ತೆ ಅವ್ರಿಗೆ, ಬಾಯಾರಿಕೆ ಜಾಸ್ತಿ Cinchona. Exactly opposite is I am using the word increase. Exactly is decrease. Opposite is decrease. No. Thirstless remedies. Can anybody talk of thirstless remedies? Thirstless remedies. Joragi. Very good. Correct. Yes, correct. Good. Pulsatilla. Epius. Good. One more. Beautiful. 3. Good. Now, when I use the word 3, what should come to your mind? You getting my point? Trios of flatulent remedies. Cinchona. Good. At least Cinchona, I am happy. Chalo, good. Cinchona. Then 2 more. See, I have been using the word trios from the day I started Cinchona. None of you have gone back, or none of you at least made an effort to ask, sir, which are the other 2? It's not Nux vomica. Nux vomica is also a very good remedy for gastric complaints, but Nux vomica will not fit into those 3 trios. Good. Nux vomica, agreed. Bere. Cinchona is 1. 2 more. No, none of you. Some guess. See, once I use the word guess, lot of words come up. No. What is it? Jorage. One second, let at least. ಏನಂತ ಕಾನ್ಫಿಡೆನ್ಸ್ ಹೋಗ್ಬಿಡುತ್ತೆ, ಯಾರೋ ಆನ್ಸರ್ ಮಾಡ್ತಾರೋವಾಗ when we are listening to them, you people showed some other wrong answer, the right answer girl also will lose confidence. See, she told right and she is keeping quiet. All wrong answers, you are shouting more louder. Very good. Carbo-veg ಒಂದು, Cinchona ಒಂದು, one more. ಜೋರಾಗಿ ಅಲ್ಲೇನಾ? ಯಾರೇನಂದ್ರೆ? One more. The other one is lycopodium. Okay? So whenever the word trios comes, and Dr. Nash was the person who gave this trios. Okay? So whenever the word trios comes, trios of flatulent remedies come. The first is Cinchona. You also have carbo-veg, you also have lycopodium. Viva question. Beautifully you told about thirstless remedies. Pulsatilla, Apis, Gelsemium. Ashta. But as your friend was trying to contribute, there are many thirstless remedies. There are many remedies for gastric complaints, but these are top remedies. Okay. Cinchona dalengirata thirst? Increased thirst. Increased thirst for cold water. So under stomach, you will be talking of indigestion. One more simple example, simple heading we missed here is, very good, beautiful. Who was that? Louder. Yarado? Appetite. Chalo, very good. Appetite is absolutely right. What can happen with appetite? It can either increase or there can be decrease or loss of appetite. Cinchona is a remedy in which the appetite is decreased appetite. We will also try to understand after 2-3 minutes why the appetite is decreased in Cinchona. Okay? Any questions here? Stomach of Cinchona is what we are trying to understand. Yena keladidiya? Louder. Yes or no? No. We'll continue? Okay. See, after stomach, under abdomen. Okay. We have few more areas we need to understand. What are all the other things that will come under abdomen? Keep Cinchona in your mind and think. Very good. Liver. Kidneys, good. Pancreas, chalo, no problem. Okay. Yeah. See, the other organs, Cinchona effectively acts will be liver, topping the list. And again, one of the top remedies acting on spleen. Artha? Again, as a physiology student, you should start thinking. Or as a pathology student, you should start thinking. Liver, what all can happen? What can Cinchona do on spleen? Okay? And another very important organ Cinchona affects will be the gallbladder. What is it? Gallbladder. So under gastric, we'll continue under gastric. We have Cinchona acting on the liver, on the spleen, and of course the gallbladder. Now the next step is, we'll try to understand what will Cinchona do acting on all these three organs. Acting on liver, ಏನು ಮಾಡಬಹುದು Cinchona? Yes, it's an important remedy for jaundice. Hepatitis ಇದೆ, jaundice ಇದೆ, ಆಯ್ತಾ? Fine? Okay, and yeah, I know your pathology students will talk a lot of things. There is also cirrhosis to do with liver. But in Cinchona, typically we have hepatitis, we have jaundice, okay? And on gallbladder, this is a very important remedy which can cause three important things. One, ಏನದ? Cholecystitis. What is it? Inflammation of gallbladder. One, good. And second thing is cholelithiasis. Stones. Good, correct, very good. Agreed. Stones. Just today, we had a case, a fresh case all the way from Tirupati. They have come for gallstones. She's a lady who's got 8 mm gallstone, and 8 mm, not too big. Don't worry. It's just mm, and they have advised surgery for her. So somebody recommended, and she's come to our. This morning in the department I was just taking her case. So cholelithiasis. Okay. Again, as a second year student, you will be studying in your systemic pathology. What are all the clinical features of cholelithiasis? Pain ingiratte, yenu yatta. You should know. Yes, you should know. Fine. Tomorrow somebody comes, you should know it is a case of cholelithiasis, what investigations, etc., etc. You should know. So Cinchona acts on liver, acts on gallbladder, and the last area I told you was spleen. Again, I told you have few remedies which tops the list when we see remedies acting on spleen. And Cinchona is one such remedy, acting on spleen. It causes inflammation of spleen. And any small correlation as a physio student, spleen. Very good, Jorage. We'll freeze that answer. Somebody said something there. Yeah, it can cause splenomegaly, but then, very good, RBCs. Go back to physio. Yes? Okay. And that's how it's also a remedy for anemia. Anemia, when you have spleen as a pathology, you can think of Cinchona. So gallstones है इसमें, and there is something called as gallstone colic. What is it? Gallstone colic. What is colic? Colic. See, colic. So pain related to intestines, we call it as colic. And pain due to gallstone is gallstone colic. And Cinchona is a very good remedy for gallstone colic. Again, if you read in your systemic pathology, one important symptom of gallstones is flatulence. They will have excess gas formation. Okay? And Cinchona is a very good remedy for flatulence. So gallstone colic, a pain kadime ಮಾಡೋದಕ್ಕೂ ಯೂಸ್ ಮಾಡಬಹುದು, or as a constitution it can help in dissolving the stones. It can help in dissolving the stones. Okay? So gallstones, gallstone colic, inflammation of gallbladder, liver, spleen. Any other area you expect that this will act? See, naturally when it acts on liver, it's a very good remedy for anemia. What else do you expect in abdomen? Think and answer. Prashna artha aita? It's a very good remedy for liver affections, and it's also a very good remedy for anemia. So what else do you expect in abdomen in Cinchona? Think and answer. No hurry. We are not giving any chocolates here if you give a right answer. Second year student, you are exposed to clinical classes. More than insulin is more to do with, don't worry, more to do with pancreas. Good. नहीं, मेरा सवाल समझ में आ गया आपको? क्या सवाल क्या? What is that one more important symptom? I'll not put it as symptom. What is that one more important sign you can see in Cinchona? Somebody said obesity. You can still take something from that. Yeah, see, Cinchona can also be a very good remedy for hypercholesteremia. Good, agreed. Then it can also be a very good remedy for ascites. Ascites, yes, heard of it? No, okay. See, like when you have fluid accumulation in the peritoneum, you have studied this in your anatomy, applied anatomy, that is ascites. And liver affections, okay. Somebody was using the word cirrhosis. Cirrhosis can give rise to ascites, okay. So we have seen they tap the fluid, liters, 2.5 liters, 2 liters, they tap. And if your remedy is right, you can do wonders. So Cinchona can also be a very good remedy for ascites, okay. What is that we are missing in abdomen? What is the last area? Intestines, and it's again a very good remedy for gas, flatulence. But the speciality of Cinchona, there is gas here, there is also gas here. But in Cinchona, remember, they will not be better by burps, nor they will be better by passing gas. It's all full. And there are many people now, gas nikal gaya piche se ya upar se, they feel relieved. Forget about others, but at least they feel relieved. Fine? Cinchona dalli, they will not feel relieved. This is how you will be differentiating Cinchona from other two flatulent remedies. Which were the other two? Carbovage and lycopodium. Carbovage, this distension is more in the upper abdomen. And naturally, once they burp, carbovage feels better. Remember, carbovage feels better when they burp. Similarly, lycopodium will have distension more in the L for lyco, L for lower abdomen. And lycopodium feels better when it passes gas. Cinchona daleno? What are all the two distinguishing points in Cinchona? Cinchona daleno? Distension is both in upper and lower abdomen. Distension or gas is not better either by burping or passing gas. This is how Cinchona becomes, different. Lyco they are better, and lyco it is in lower. Carbovage upper, and they feel better by burping. Cinchona is neither better by burping nor passing flatus. Important. What is that last area in Cinchona? J. Rectum, very good. Now what do you expect in rectum? Okay, so again talking about common things that you can expect. There can be diarrhea, there can be constipation, there can be hemorrhoids. In Cinchona, there is diarrhea. There is more of diarrhea. What causes diarrhea in Cinchona? Very good, indigestion. Fruits. Diarrhea from eating fruits. Diarrhea, aggravation eating fruits. Okay? Is Cinchona.
So, but the aversions is fruits.
Aggravation, I am using the word aggravation.
No, sir, but they don't like eating fruits.
Correct. See, for example, many times even you don't like so many things. Parents force, no, you should drink milk. If you drink milk, you will become strong. Fine. You drink, what will happen? Not necessary everybody will have diarrhea. Fine. Cinchona, again, see, that's what I'm trying to tell you. What is that common thing? Fruits is good for health, no? Yes, and I don't think any parent will say no from eating fruits. And unless you are Cinchona, fine. You have an aversion, but then again you are forced to eat, you eat. What will happen in Cinchona? They will end up having diarrhea. Huh? Okay, they will land up having diarrhea. See, good point your friend has raised here. But as a second year student, I feel you should understand. There are two things here, now that it is raised. Ondeno, aversion. Innondeno, aggravation. What is the difference? Aversion is you don't like. What is aggravation? You getting my point? You don't like milk. Fine. Yes, sir, milk I don't like. What is this? Aversion. But for example, same person or a different individual. So I also don't like milk. Or I don't mind drinking milk. But what happens? If I drink milk, I'll have stomach upset, I'll have diarrhea, I'll have cough, I'll have coughum, something like that. So that becomes, are you clear? So aversion is style asaya. You don't like. Aggravation is, you don't mind eating it. Sir, ನಾನು ಹಾಲಂದ್ರೆ ತುಂಬ ಇಷ್ಟ ಸರ್, ಬಟ್ ಏನು ಮಾಡೋ ಸರ್, ನಮ್ಮ ಕರ್ಮ ಹಾಲು ಕುಡ್ದಾಗಲ್ಲ ಡೈರಿಯಾ. ಫೈನ್, ಯು ಗೆಟಿಂಗ್ ಮೈ ಪಾಯಿಂಟ್. ಸೊ ಮಿಲ್ಕ್ aggravation. Hala, the moment you say milk, the child will run. Mother is behind him, running. Fine. So that is aversion. I don't like milk. As a second year student, you should be very, very clear. Tomorrow they come to your clinic. Patience, you should have clarity. So this remedy has got aversions, and this remedy also has an aggravation from fruit. Fruit is style orga. Fruit tindre they will have diarrhea. And diarrhea in Cinchona is painless. You understand? Yenangandre? When they are passing stools, they have got absolutely no discomfort, no pain. Painless diarrhea. Okay? And diarrhea is more at night. Cinchonadalli diarrhea is more at night. Diarrhea, painless. Natural diarrhea means it will be watery, all that you can write. It is aggravated at night. It is aggravated after eating fruits. Painless. It is important. Why was it? Okay. Now this question is a question that will come up for 5 marks in your exams. Gastric symptoms of Cinchona. Any questions? Any doubts? Udugro? Exam point of view. So you'll be starting from mouth. You can talk about toothache. You can talk about bleeding gums. Then you'll be going lower down. You'll be talking about stomach. Yenem baritira? Nausea, vomiting, good. Indigestion. Flatulence, gas. Appetite is decreased. Increased thirst. Desires, aversions. Okay. And that food getting fermented. Food stays in stomach for a longer period. Okay. And foul smelling burps. One thing we missed in stomach. That's what I'm asking. What is that one thing we missed in the stomach? Okay, something close. Good. Something close. Somebody, you told 2 points before when we started revision. You told 2 common points. What were those 2 common points? You are talking of bleeding nose and bleeding gums, no? So you can also have hematemesis. What is hematemesis? We also had another remedy, no? Few days back when we were discussing yadado? Spongina? Unfortunately, ಎರಡು remedies ಆಗಿರೋದು ಅಲ್ಲ. The remedy is Drosera. Drosera also had hemorrhagic tendency. So they vomit. Coughing is different. Coughing is hemoptysis. That also you had in Drosera. Here you have hematemesis. Something we missed. Okay. Then lower down we saw, don't forget this, the liver, the gallbladder. Okay. And of course the spleen. And kidneys, what was its action? Inflammation, nephritis, albuminous urine, all that will come under kidneys. Okay. Now, very important for you will be the female. Again, think and answer. What are those 2 or 3 things that you need to remember? You need to remember in Cinchona. Huh? You know, yes, it's hemorrhagic remedy. Allah. So there can be excess menstrual flow. What is it called? Yeah, very good, professor, but the medical term. Menorrhagia, metorrhagia, or there is also another term you need to remember, DUB. Huh? Dumb? Hey, don't give me your own new things. DUB. ಏನು DUB ಅಂದರೆ? No problem. Dysfunction uterine bleeding. Dysfunctional uterine bleeding. Okay. So there will be continuous flow, but when you get the scanning and the investigations done, everything will be normal. Dysfunctional uterine bleeding, DUB. Now when will you give Cinchona? Huh? Remember, Cinchona is not the only remedy for DUB. Cinchona is not the only remedy for menorrhagia or metorrhagia. Cinchona ಯಾವಾಗ ಕೊಡ್ತೀರಾ? Yes. One is the flow is dark. The flow is clotted. Good. Then think, good. You are in the right track. Go ahead. What will happen because of bleeding in Cinchona? What is it? There is weakness, bad weakness. Bad weakness. There is debility. Because of this, they feel weak, they feel tired, they might have headache, they might have loss of vision, they might have giddiness. All these things will be associated in Cinchona. So menstrual problems, in Cinchonadalli there will never be scanty menses. You will always have a profuse flow, dark flow, and this is also adding to anemia. This excess menstrual flow is also a reason for anemia. And as somebody rightly said, loss of vital fluids. Loss of vital fluids. Okay? That is Cinchona. So this is what I want you to remember. And what else we saw under female sphere of action? It will increase sexual desire. Increase sexual desire. In male? Decreased sexual debility. Sexual weakness. In male. The last area again is fever, and probably this is where this is how we are all here. Allah, this is what happened when Dr. Honeyman took Cinchona. Yes. What type of fever he had? Malaria. What type of fever is malaria? Very good. Now, what is the specialty of intermittent fever? Yeah, very good. It is periodical. It will typically have 3 stages. Chills irutte, heat irutte, and then there is sweating. So one more question which can come for your exams for 3 marks will be fever. Fever of Cinchona. So the first point you will be writing is Cinchona is mainly indicated in intermittent fever. Intermittent fever. So chills, and see, you will also come across many more remedies. Okay. In Cinchona, the chill stage, the heat stage, the sweat stage, all the 3 stages are very prominent. Prominent on the, you will be studying few remedies in future where chill, they'll just get some small chill, and then heat stage might be prominent or the sweat stage may be prominent. Cinchonadalli chilsu, chali, shake and sweating, all the 3 stages are prominent. Okay. Now what is very special in Cinchona? Chali ellagate Cinchona. Chills in Cinchona, they mainly felt in the breast. First part that becomes cold here is chali. Where do they feel? They feel it in the breast or chest. There are different remedies. Which are all the other remedies that are over for you? Which is the remedy which will have chills in the back? I don't know if it is over or not. Yada? Chalo, don't worry. You have got different remedies. You have gelsemia which will have chills only running down, up and down the spine. Chills alli shuru aata hai. Cinchonadalli elli shuru aata hai? Chest, or if you want to be more specific, breast. Chest is a larger area. Cinchonadalli they will have sweating. The sweating starts more in breast. Okay? Fine. So chills in breast, and one more very characteristic symptom is in between the stages of fever, they will have thirst. You are following this? ಏನಂಗಂದ್ರೆ ಚಿಲ್ಸ್ ಆಯಿತು, ಚಿಲ್ಸ್ ಆಗಿದ ತಕ್ಷಣ ನೆಕ್ಸ್ಟ್ ಏನು ಬರಬೇಕು? ಸಿಂಕೋನಾದಲ್ಲಿ ಏನಾಗುತ್ತೆ? ದೇ ಫೀಲ್ ಥರ್ಸ್ಟಿ. ವೆನ್ ದೇ ಹ್ಯಾವ್ ಚಿಲ್ಸ್ ದೇ ವಿಲ್ ನಾಟ್ ಫೀಲ್ ಥರ್ಸ್ಟಿ. ಚಿಲ್ಸ್ ಆದಮೇಲೆ ದೇ ಫೀಲ್ ಥರ್ಸ್ಟಿ, ಆ್ಯಂಡ್ ಆಫ್ಟರ್ ಥರ್ಸ್ಟ್ ದೇ ವಿಲ್ ಫೀಲ್ ಹೀಟ್. ದಿ ಎಂಟೈರ್ ಬಾಡಿ ಫೀಲ್ಸ್ ಹಾಟ್, ಆ್ಯಂಡ್ ಆಫ್ಟರ್ ಹೀಟ್ what will happen again? Thirst. And then they'll start with sweating. Entire body sweats. And what is the character of sweating in Cinchona? Very good. Profuse is one word. I'm happy. One more word to complete Cinchona. Debilitating. What is it? Debilitating. Debilitating means it will cause weakness. The sweat in Cinchona is not only profuse, the sweat in Cinchona is also debilitating. It will cause weakness. Chill stage, heat stage, sweat stage. These 3 lines if you write, you will get 3 marks in your exams. So the last part of Cinchona will be modalities. What aggravates, what ameliorates. What aggravates? See, one small clue I'll give you. Many of the ailments in majority of the remedies can be aggravating factors. So for example, fruits, touch, yes, touch, night. What aggravates in night? Very good, diarrhea. See, there are 2 things you'll have to remember. Can somebody help me? What are those 2 things? Modalities are of 2 types. Yes, very good. General modalities and particular modalities. For example, aggravation night, is it a general modality or is it a particular modality? Why is it not general? ಅರ್ಥ ಆಗ್ತದ? ಬರೀ ಡಯೇರಿಯಾ ಸಿಂಕೋನಾದಲ್ಲಿ ರಾತ್ರಿ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಬೇರೆ ಎಲ್ಲ ರಾತ್ರಿ ಜಾಸ್ತಿ ಆಗಲ್ಲ. ಹಾಗಾಗಿ ದಟ್ ಬಿಕಮ್ಸ್ ಎ ಪರ್ಟಿಕ್ಯುಲರ್ ಮೊಡಾಲಿಟಿ. ಎಲ್ಲ ಕಂಪ್ಲೇಂಟ್ಸು ರಾತ್ರಿ ಜಾಸ್ತಿ ಆದರೆ ದಟ್ ಬಿಕಮ್ಸ್ ಜನರಲ್ ಮೊಡಾಲಿಟಿ. ಓಕೆ. ಟಚ್, ಈಸ್ ಇಟ್ ಜನರಲ್ ಆರ್ ಪರ್ಟಿಕ್ಯುಲರ್? ಯಾಕೆ? ಹಲ್ಲು ಬಂದರೆ ಅಲ್ಲ. ಈವನ್ ದಿ ಕೋಲಿಕ್ ಆಫ್ ಸಿಂಕೋನಾ, ವೆನ್ ಯು ಟಚ್ it increases, but when you press, high agide. Same applies to the head, alla headache muttidre somebody is hyper sensitivity, okay, but when you press them, eeg chenagide. You get my point? So touch aggravates is a general modality. Pressure amelioration is again a general modality. So pressure ameliorates, and Cinchona will have distension. So what will Cinchona person do? Think. I am throwing this question to you. Fine. Cinchona will have distension of abdomen. So what will Cinchona do? Okay, more than lying on stomach. Fine. That could be a probable thing. Think. What is? Small. Just is like a scored. More than tying, they loosen. Fine, they loosen. ಇದು ಏನು ಬೆಲ್ಟ್ ಲೂಸ್ ಮಾಡ್ಕೊಳೋದು, ಆರ್ ಹೆಂಗಸಲ್ಲಿ ಲೈಕ್ ಸ್ವಲ್ಪ ಲೂಸ್ ಮಾಡ್ಕೊಳೋದು, ಸೊ ದಟ್ ದೇ ಫೀಲ್ ಬೆಟರ್. ಐ ನೋ ಪ್ರೆಷರ್ ಇಸ್ ಅನ್ ಅಮ್ಯುಲೇಟಿಂಗ್ ಫ್ಯಾಕ್ಟರ್, ಅಗ್ರೀಡ್, ಬಟ್ ಲೂಸ್ನಿಂಗ್ ಆರ್ ದೇ ಕೆನಾಟ್ ಟಾಲರೇಟ್. ದಿಸ್ ಈಸ್ ಅಗೇನ್ ಅ ಕಾಂಟ್ರಡಿಕ್ಟರಿ ಥಿಂಗ್ ಇನ್ Cinchona, ಅಲ್ಲ? ಆಲ್ಮೋಸ್ಟ್ ಆಲ್ ಕಂಪ್ಲೇಂಟ್ಸ್ ಆರ್ ಬೆಟರ್ ಬೈ ಪ್ರೆಷರ್, ಬಟ್ ದಿಸ್ ಅಬ್ಡಾಮಿನಲ್ ಕಂಪ್ಲೇಂಟ್ಸ್, ದಿ gaseous distension, they feel like loosening their dress around the waist. So pressure ameliorates, warmth ameliorates, okay, and we spoke of another very important thing, that they want the garments or the dress to be loose. What aggravates? Touch. Fruits aggravates, night aggravates, okay, cold aggravates, okay. So what type of patient is Cinchona? Chilli na hota? Now what are we trying to conclude here is the thermals. Why chilli? Why chilli? Cold aggravates and warm ameliorates. They want to be warm. Exact opposite. Who wants to be warm? They are chilli. Who wants to be they want fan, gin, etc. They are hot. ಎಷ್ಟೋ ಜನ ನೋಡ್ತೀವಲ್ಲ, ಎಷ್ಟು ಚಳಿ ಇದ್ರೂ ಒಂದು ಬನೀನು ನಿಕ್ಕರ್ ಹಾಕೊಂಡು ಓಡಾಡ್ತಾ ಇರ್ತಾರೆ. ಫೈನ್. ಆ್ಯಂಡ್ ಎಷ್ಟೋ ಜನ ಸ್ವಲ್ಪ ಗಾಳಿ ಬಂದಿದ ತಕ್ಷಣ ಯು ಸಿ ದೆಮ್ ವೇರಿಂಗ್ ಥರ್ಮಲ್ಸ್, जो भी मोटा मोटा कपड़ा है ना अंदर सब बाहर आ जाएगा. So they are extremely chilly. They are extremely chilly. Fine. So thermally Cinchona is chilly. Now before we conclude, the key points that you will be taking home, or what is it that you need to remember whole of your life, is that this is the first remedy. Fine. Though it's not very practical. And then we saw that it's a very good remedy for intermittent fever, gallstone colic ide, liver pathology, spleen pathology, diarrhea, the female, the male, okay, the intermittent fever, and of course the neuralgias, okay, you can think of Cinchona. And it had a good amount of mental symptoms also. From the word that they are artistic, they are poetic, okay, and that sensitivity, and again a very egoistic person, very haughty person. Those were the mental symptoms that we try to understand. It's a hemorrhagic remedy. The character of hemorrhages are dark hemorrhages. Okay. Any questions? Cinchona. Exam point of view, I have already written on the board, gastric 5 marks and fever for 3 marks. Any questions? Hudugru? Nothing to ask?
Sir, you mentioned about that distension of
Abdomen.
lower,
Yes.
every remedy, 3 remedies, no, sir. How is it different in terms of nausea when they are having gastric problem?
How is it related to nausea?
Nausea.
Okay, fine. See,
Because people with gastric problem, they have nausea also. So 3 remedies are there.
okay, chalo. No problem. See, like, not necessary that every person who's got gastritis should have nausea. First point. Okay. And here we are limiting these 3 remedies, we are limiting to the distension, the gas formation, and what are all the areas they affect and how are they better. Okay, fine. See, nausea, at least in these 3 remedies, I'll check and let you know how it is. But when you talk of distension, this is not related. Fine. Because see, what did I tell you in carbo-based? It is, the location is more of the upper and they feel better by burping. And what did I tell you in Lyco? More lower and they feel better by passing flatus. In China, it is both upper and lower. But what is the modality? They are neither better by passing burping or they are better by passing gas. Not that they are not passing. Even if they are passing, they don't feel better. Adu isu. These 3 remedies. Specifically nausea, I'll just check and let you know. Okay? Fine, because I'll just see, I'll have a look and I'll let you know. Fine? But at least not necessary that every person who's got gastritis should have nausea. When will you have nausea? Forget about, don't worry about stomach. In general, nimge ವಾಕರ್ಕ ಯಾವಾಗ ಬರುತ್ತೆ? Fine? When you're tense? Think. ಜೋರಾಗಿ ಬ್ಯೂಟಿಫುಲ್ ಏನದ ಕರೆಕ್ಟ್ ಅದಕ್ಕೆ ಹೇಳೋದು ಹುಡುಗರು ಜೋರಾಗಿ ಹೇಳ್ಬೇಕಂತ ಏನು ಯಾವಾಗ ವೆನ್ ಯು ನಾಸಿಯೇಟ್ ಐ ಆಮ್ ಟಾಕಿಂಗ್ ಆಫ್ ಎಮೋಷನಲಿ ವೆನ್ ಯು ನಾಸಿಯೇಟ್ ಯಾರೋ ನೋಡಿದ್ರೆ ವ್ಯಾಕರ್ಕ ಬರುತ್ತೆ ಯಾಕೆ ವ್ಯಾಕರ್ಕ ಬರುತ್ತೆ ಯು ಡೋಂಟ್ ಲೈಕ್ ದಟ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಪರ್ಸನ್ ಸಿ ರಿಮೆಂಬರ್ ಆಸ್ ಯು ಗ್ರೋ ಆಸ್ ಅ ಹೋಮಿಯೋಪತ್ ಪೀಪಲ್ ವೆನ್ ದೇ ಸೇ ವ್ಯಾಕ್ ಅನ್ಸುತ್ತಲ್ಲ they are not happy with something. There is something called as disgust. You have a disgust, you have a dislike, you have a disgust. Then nausea will start. That's little higher, we'll talk it later. But now, because she said nausea, instead of me not telling something, I thought this is very important. So nausea comes when you don't like. When you like somebody, do you nauseate? Yeah. A nausea na hoಗ್ಬಿಡುತ್ತೆ. Somebody whom you don't like is there, you feel like nauseating. Somebody whom you like comes, that nausea will go. You are getting my point. So what I am trying to tell you is, these are all emotionally related. We'll talk of that after some time. Any more questions? Any questions? Is Cinchona clear? You have taken solid 3 hours. Fine, but I personally feel it is worth, because this is the first constitutional remedy I am talking to you. So I should convey what I want to try to tell. Have I conveyed? ಹುಡುಗರು ಅರ್ಥ ಆಯ್ತಾ? Anything you have, you can please ask, I'll clarify. So Drosera was different, Spongia was different, though there are some common things. Okay? We decided in the last class how is Drosera, how is Spongia, and one remedy we spoke was Cinchona. No questions? So, thank you.